Hello, welcome to What's Up Doc. I'm your host, Dr. Grego, and for the next half hour, we're going to take you on a journey through health, healthier lifestyle, healthier living, and how exactly do you do it. So stay tuned. Hey y'all, Dr. Grego back again with another episode of What's Up Doc. Today we're going to take you behind the curtain. We're going to see what really happens inside a chiropractor's office. Do you really get cracked? Do you really get racked? Do things really pop? I don't know. Let's find out. We have Miss Tonda here on the table. Say hello, Miss Tonda. Stick your head up there.
Hello.
All right, Miss Tonda. And she really does have a problem. At least she does work for me. You would think people working for me don't have problems, right? Because they work for me. But that's not the case. They still have problems just like everybody else does. Neck, shoulders, she happens to have a foot. And so what we're going to do, we're going to stretch her out a little bit just to start off. Okay, we're going to stretch. How's that feel, Tonda?
Great.
Does that feel okay?
Yes, sir.
Does it feel like a dentist?
No, sir. Not
Okay, that's
yet.
good. No offense to the dentists out there. They're probably going to email me and give me a lot of grief about that. But all right, so we stretch out the spine. Tonda has a little rotation. If you see from the camera, if the camera kind of drops down a little bit, you're going to notice that this hip is a little bit higher than this one. In fact, this glute is a little more rounded than the one on the right. So we're going to slide this up underneath here, drop it down. The table is going to come up. You're going to notice that little noise, but I didn't touch her. Let me do it again. See that right there? Table, not me. So I come over this opposite hip, drop it down just a little bit, okay? Now I'm going to pull this block out. Relax, Tonda. Now look at the hip. I know the camera's probably on an off angle. It should be kind of down here at the hips. But you would have noticed that now that these hips are level and the same glute size on the left is the same glute size on the right. And that is an adjustment. Tonda, how did that feel?
Great.
Okay, so why is it important to balance out the hips? Because we stand on 2 feet. And so what's above the hips? Everything else. Your low back, your mid back, your neck, your head. If you want all those things to sit square, if you build your house on an unlevel foundation, is your house crooked? Is it perfectly straight? No, it's crooked, right? So it's very important to have this pelvis balanced and in the right place. So that's what we did right there. Now we're coming up the spine. We're feeling for, what am I feeling for? I'm pressing down on the spine. I'm feeling for movement, right? I'm feeling for movement. I'm feeling for motion. And when a certain segment doesn't move, like right in here, right, I can press on Tonda and say, hey Tonda, how's that feel? She said what? She said So you couldn't even say because it hurts right there. We call it a Hertz donut. It's not the kind of donut you want to eat. It's not the kind of donut you want in your back. So then I feel for which size it rotates. Is it to the left? Is it to the right? Is there a wedge on the right? Is there a wedge on the left? There's actually 15 different ways. And that's one of the things that really annoys me as a chiropractor, as long as we're talking. When people say, oh, I can adjust myself, or my friends at work come behind me and squeeze me, or I can take my head and neck and go like this, and I'm adjusted. No, you're not. You're stretched. You're stretching out your ligaments, and you're loosening them. And I'm going to give you a graphic illustration of my point right now. If you took your hand inside your underwear, right, and I realize it's a family show, this is as far as I'm going, but if you stuck your hand inside your underwear and you pulled several times throughout the day, right? Several times you twist, several times you go like this, several times you get squeezed. Okay, so several times you do this. At the end of the day, where's your underwear going to be? Up around your waist or down around your ankles? Okay, hello. So there goes your elasticity, right? Because we don't stretch things. We don't stretch underwear and we don't stretch the spine. What we do is very, very gently and specifically adjust one of the 15 different ways that a bone can go out of place, that way back in. Because how many ways, if there's 15 ways to go out, how many ways is there to go back in? No, try again. There's only one right way. There's 14 wrong ways, but there's only one right way. Okay, take a deep breath. All the way out. And we follow her down. Boom. And that was the set, right there. Tonda Parham?
Yes, sir.
How did that feel?
Good.
You didn't say ow.
No.
Not like when I pressed on it.
No.
So let's press on it again. Let's put my whole hand on it. Let's, Tonda Parham?
You see?
Huh?
Feels good.
We didn't get the first response that we get. Well, so it's back in place. Why does that matter? Because she's got nerves coming through here. This nerve right here is T6, the 6th thoracic. Where does that go? To her stomach. So how does her stomach know how much hydrochloric acid to pour out when she eats something or if she's not eating something? Is it important not to put out hydrochloric acid if you're not eating? Yes, because if you do, you'll get a hole in your stomach called an ulcer, right? Is your stomach smart enough to know how much hydrochloric acid to put out or when to put it out? Look at my head. No, it doesn't have a brain. So well, you do have a brain, but how does it get down to your stomach? Through T6. It sends a signal back down, the stomach sends a signal back up, and that's called communication. And that's how things work in the body. Things communicate with the brain, and they have to come through the spine. That's why it's super important that your spine's aligned. Because if it's not aligned, then you can't communicate, and if you can't communicate, you got trouble. You got trouble in your relationship, you got trouble in your body. If you can't talk about something, then you can't fix something. All right, turn over, Miss Tonda, all the way, please. Well, wait a minute. Before you turn over, we got to scan down. I almost forgot. She also has knee issues along with her feet. And when she turns back over, I'll let her tell you the quick story without mentioning a name. Tonda knows the business. Okay, so right here. Y'all you're missing this. Go ahead. Go up there on her head again. Watch this. I'm sorry. That's bad. I could only laugh. I would never do that to a patient. I'm sorry. I just went it, but it kind of tickles me too. But mostly on the inside. I would never show it on the outside. So right here, she's got that Hirsch donus again. This happens to be the lateral epicondyle, right, off her tibia. And when it's rotated, when it's twisted to the left, it pops up on the right. And that's why it's super tender. So what I do is I put some gentle pressure right over it, and we slide off of it just like that. Boom, and that motion right there drops it back in place. Oh yeah, and we're going to see how she can move this at the end when we're all done. And we should have done it before and after. How is it on a scale of 1 to 10, Tom, before we get started? Like your knees right now today, what were they?
About 7.
About a 7. Okay, what about that beautiful foot?
Oh my God, about an 8.
About an 8. Now that's been giving you some challenge lately, right?
It has.
Okay, all right, so let's check the other knee, and then we're going to flip over. See, Tonda's a good candidate because Tonda's got a lot of things. Tonda's got a lot of things going. God bless you, Tonda. All right, so we're sliding down. The knee's okay, but right below there, I'm feeling right here. Oh. So we got a little something right below the calf. The calf's right here on top. Below there is the soleus. We got another muscle right underneath there. And when we pressed in on that guy, yeah. So what had happened was that's got a little spasm, got a little tightness in it, relaxed. And now Tonda happens to be wearing the right shoes, which are Nike Frees, right, Tonda?
Yes.
Okay, now did you happen to wear anything besides Nike Frees in the last 24, 48 hours?
No.
What about 72 hours?
No.
What about on Sunday at church?
Yes, I wore a shoe. Besides Nike Freeze, it was a flat shoe though.
It was a flat shoe.
Very flat.
But I'm going to have to go ahead and take a guess that it might not have been all that flat. Because what happened was she shortened up her Achilles tendon, which shortened up these muscles, and which put a strain in them. It's going to put a spasm, because now when she went back to the flat shoes, it pulls it down more, and the muscle is used to being shorter because of those other shoes, which shall remain nameless. And so now we have an issue right here with the soleus. So here's how we fix that. We come in on the soleus, we push the foot up. Now I want you to push down against there you go, Tonda, good. And push down against my knee, good. And one more time, push down against my knee, excellent. So this is called trigenics. Basically we're putting a strain or a distortion into the muscle belly. Thereby, the mechanoreceptors in the muscle fire off into the cord. The cord goes up the same side cerebellum, opposite side cortex, and tells the brain to go ahead and let loose and relax down here. Wow, that was a mouthful, wasn't it? So that's what we were doing in there. So now when I press in here, Tonda, we don't hear Tonda, do we? And look, I'm really pressing on Tonda. So I'm not pressing lighter, I'm pressing more, because a lot of people say, oh, he didn't press as hard, or he didn't move it as hard, or that muscle's weaker. Okay, keep thinking that. In the meantime, Tonda, go ahead and turn over on your back, please. I know we got other issues. Ooh, Lord. Now, before we get down to the big one, and I'm going to let you talk about it for a minute, because I know you like, even though that's not your story, right?
Right.
So many people, I want to stop there for a moment because a lot of times it's unfortunate that people identify, oh, my sacroiliac, oh, my calf, or oh, my foot, oh, my aching foot, or oh, my knee, my bad knee. It's my knee that's bad. It's my back that's bad. It's my neck that's bad. And then it becomes part of you because you're identifying with it. That's dangerous. That's very dangerous. You are not pain. You are not a bad body part. You're not even your body, but I'm not even going to go there because that's for another show. But the point is, don't identify with pain, because when the pain leaves, then you have to leave. And you might not want to leave, but you might want to still be here. So what am I saying? Just know that that's a transient thing, something that's just here for a moment, something that's kind of waking you up to something that's going on in your body that's not quite right yet. And let me share that with you too while I'm on it. I'm trying to go too far off tangent. You might have to stop me. But when you ask your child, or you ask yourself, what's wrong with you, or what's wrong with me, right? You're going to get a list of all the beautiful things that you are. You're going to get a list of, well, you're slow, you can't speak right in the morning, you got to have coffee before you can get going, you don't clean your room enough, you don't clean your car enough. Do you really want to know all those answers? So what do you want to know? What's not right yet? Instead of what's wrong? What's not right? And then you'll focus on, well, what's not right yet? Well, I need to exercise a little bit more. I need to eat a little bit better. I mean, I need to drink water in the morning instead of maybe coffee all the time to get myself going. Okay, so those things are going to make you right. They're going to empower you. They're going to make you stronger. You understand? Okay, great. So come on back up here. This is a light work right here for Tana. She doesn't have too much of an issue in the neck. So what we're going to do, we're going to palpate very gently in the neck. Tana, how's that feel? Is that like pulling the teeth?
No.
Okay. What about cleaning teeth?
No.
Because there's still blood even when you get your teeth cleaned sometimes, isn't it? Yeah, you got gum disease or something. All right, so we're palpating, we're feeling around. I feel something at the very top right here that's not moving. That's C2. Might not be giving her pain, but it's blocking function. C2 goes to the eyes, C2 goes to the nose. Okay, so we don't want any issues with those. Relax right here. I want you to zoom in here. Watch how gentle this is. Relax. Let's listen. Okay, Tonda.
Feels good.
Scale of 1 to 10. How much pain was that?
0.
What?
Yeah.
But we heard all that little noise.
0.
Okay. Well, I hope it didn't offend anybody. I hope anybody didn't get too scared of that. But that was actual neck adjustment. You see all the twisting and cranking I did? You see how much force I put in? Yeah. Well, you know, it's unfortunate. 2 things I'll say about this. One, there's good and bad in every profession, right? In other words, there's good basketball players, and there's not so. There's guys that sit on the bench, right? And there's a reason why they sit on the bench. And maybe professionals need to have a bench too. I don't know. What I'm saying is, you know, there's good and bad dentists. There's good and bad orthopedists. There's good and bad medical doctors. Well, there's unfortunately good and bad chiropractors too, and good and not so good. So what's my point? You want to find somebody, if you're getting hurt and beat up, feeling you're beat up after going to a chiropractor, you might want to think twice about it, or ask them if they could adjust a little bit lighter, or ask them if they have an instrument to adjust with, something that could just tap. Okay, all right, so second point, when you heard that little noise, those little popping sounds when we adjusted her neck, people are like, oh, that's the bones grinding together. That's causing arthritis. That's going to paralyze her. That's going to make something horrible someday. Okay, back to reality. I've adjusted about 15,000 people over the last 25 years, and nobody has gotten worse. Nobody's gotten paralyzed. Nobody's gotten... Okay, my malpractice insurance is less than $900 a year. Doctors out there, you know I'm telling the truth. Does the insurance company care who you are or what you are? In other words, if you have the potential to hurt somebody, your premiums are going to go regardless. But chiropractors, if you hurt somebody, or OBGYNs, if you hurt somebody, which by the way, to give you some reality, a GP, a general practitioner, might pay around $20,000, $30,000 a year malpractice. A OBGYN, a baby doctor, might pay upwards of $100,000 a year. And then you have, less than $1,000 a year. Okay, so what is that popping sound then? The popping sound is basically when you have a dart that goes against the window. Right, if I had a little dart gun like as a kid and I shot it and went pop against the window and then went over to the window and I pulled it off, it would make a popping sound. Question, did I hurt the window by pulling that dart off the window? No. Did I hurt the dart? No. Do I hurt your neck when I adjust it? No, because what is that? Air rushing in. It's actually nitrogen gas rushing in the joint space, but in the dart's case, it's just a vacuum that's created when you open up the space and air rushes in. When I open up the space and adjust her, air rushes in, or in this case, nitrogen gas rushes in, and it makes a little popping sound. It doesn't hurt the window. It doesn't hurt her body. It doesn't hurt her. Okay. Now, Tonda, tell the camera a little bit of history. I come down here with a few things to work on this beautiful foot.
Every now and then this left foot, it flares up and
Tell me, well, how bad was it before we started working with it? Could you wear...
I could not wear shoes on
You could
this
not
foot.
wear shoes?
No.
So people look at you funny?
Yeah, can't wear shoes.
Couldn't wear, how long did that go on?
That went on for about 2 years.
2 years she could not wear a shoe.
Yep.
Okay. Then we got you ketogenic,
Right,
and then we adjusted it,
right,
put some laser on it,
right.
and then you put on a what?
A shoe.
Well, you're wearing some today.
Yep, Nike free.
The right shoes.
Yeah.
Okay. So now it still comes and goes because, like she said, she has little damage on her nerves or to her nerves. And it's hard for them, not impossible, but hard for them to regenerate. So we have her on a regeneration program, and I'm going to explain that in just a moment. But in the meantime, we're going to go ahead and check out her foot here and see what it needs today. So we're going to motion. The foot has a lot of different bones, metatarsals, as they're called. We want to make sure each one of them is moving. We want to make sure the arch is properly formed, the talus, the navicular, the cuneiforms, all these lovely little Latin names for the foot. We want to make sure that they're all moving and in the right place. Then we're going to push the foot back just a little bit. We want to see how these plantar muscles are doing, right? We want to feel right across here. If anyone feel like a banjo, like, oh, I don't know, this first one right here. Okay, so we're going to push in. Same thing we did on the big muscle there. We're going to distort the middle of it. And then we're going to bring the foot down. And now come on up, Tonda. Come on up. Come on up. Look at her face. Make sure. Now this is what a chiropractor, but see, he's not actually adjusting. I'm working with the muscle. Relax. One more time. We got to do that one more time. Come on up. Come on up. This is what I learned from dentists when I was following a dentist around one day. I said, how can I inflict pain? No, but here we go. Look, now, not too bad. Huh, Tonda?
No.
No pain, no gain. Sometimes we use that around here. Not always. Okay, now right now I'm feeling it right there, down deep, is a bone. It's called a cuneiform. And I'm going to tap this while you wiggle your toes, Tonda. While you wiggle your toes. A little 3D movement in there. I want to make sure we get that all the way back. There we go. Now we know that bone is back. We motion it. It's back together. Okay, now we're going to take the calcaneus right behind here. We're going to stretch it. Make sure it's where it's supposed to be and moving. Good. Now the talus, excuse me, the navicular, the very top. The talus and navicular, the joint right there. Okay, good. Now we have in my hand here a biomodulator. We used the laser last time, so now we're going with the biomodulator. And this little gizmo here looks like a TENS unit, but it's not. This was actually formulated by a gentleman that worked at NASA, the astronaut, the space people. And so what we have is a particular setting. It's microcurrent, and it's set at a particular hertz, particular frequency. And so what we're doing, I'm feeling where it's stuck right here. So we're going to press in, and now Tom, you're going to tell me when you first feel like little tingling in the foot.
Feel it.
Okay. Is that too much?
No.
Okay. I'm going to turn it up a little bit higher. Stop me before it becomes uncomfortable. If it is uncomfortable, I can turn it down. Okay, so here we go. Oh, is that too much?
Yes.
Okay, I'm coming back down. How's that?
Down.
Down. Okay, how's that?
Okay.
Okay. Now, as I'm holding it, she's probably going to ask me to bring it down again because we're actually filling up her tissue cells with voltage. Huh? We're putting specific energy into the cells so that it can regenerate. Specifically, a cell needs to heal around 50 millivolts of energy. Normally, a cell operates between 20 and 25 millivolts. We're looking at 50 millivolts. And again, this little gadget right here is what's putting in the energy. And so we're going to make sure that it gets right to where it needs to be. And she's going to tell me, we're going to wait a couple minutes here, talk a little bit more. So Tonda, what, you told somebody something fell on your foot?
Yes, I had a dolly.
Wait
75.
a minute. You mean like a dolly somebody plays with?
No, what you work with.
Well, explain what, some people might know what a dolly is.
Yeah, a dolly is 75 to 100 pounds. Dolly made out of metal with the sofa on top of it for my foot.
I didn't know. There was a sofa on the dolly?
Yeah.
And they both fell on your foot?
Both fell.
Okay.
And the handle went across the foot.
The handle went across the foot too. Okay. And so that's basically the reason why.
Yep, damaged nerves in the left foot.
Damaged nerves on the left foot.
They call it RSD.
RSD.
Yeah, they try to
And I remember that you say, okay, something fell on the foot. It's no big deal. You know, we've had things fall on our foot left and right.
Right.
But it was so bad that you actually went to a. Go ahead and give props to the doctor down in Columbus,
Yeah, Dr. Goldman.
Dr. Goldman, neurosurgeon,
Yeah.
right? And he put one of these or something similar to this right here
Right. On my spine.
in her spine. You understand? Now, so you think she's just complaining to complain? Or you could take something that fell on your foot, no big deal? But it was that serious to put something like this in her spine. And you have a remote control to control this.
I do. It's right here.
You want to show everybody your remote control?
I have to keep it on me at all times.
All the time. So tell them what that does.
It actually controls it. The stimulator on the inside of the body, I can turn it up. Having pain, I can turn it up. And have different settings to kind of block the nerve pain blockage.
Okay.
Yep.
All right. So this is serious. Very serious. And you said this was at a 7? Where were we started?
No, the foot was at an 8.
The foot was at an 8. Excuse me. Don't want to diminish or demean your pain level. Okay, wiggle your little toes for a second. Wiggle your little toe. Back and forth. Wiggle them. Oh, nice, nice. Okay. That's all we need on this. Okay. We'll set that down again. Now I want to help you up. Okay. Careful, want to swing around there. Go ahead and stand up. Walk around a little bit.
I'm gonna go with overrated because the comeback
Go ahead,
was
walk down.
awesome. Everybody's all in on John Travolta.
Okay, have a seat again. Tell everybody, where is it?
It's gone.
Say again.
It's gone.
Howard,
It's gone.
the OJ documentary.
It's gone. Okay, well,
Pain is down.
pain is down. Where is it? On a scale of 1 to 10?
I would say about a 3.
About a 3. So it went from an 8 to a 3,
Yep.
which is pretty significant.
Yep.
In about a couple minutes treatment that we did.
Right.
All right. Again, chiropractors pop. Chiropractors crack things. They pop things. You might get paralyzed with these things. You might hurt yourself with these things. Pardon?
Yeah.
It's just after a while.
Okay. Well,
No,
we
but
almost
actually it's pretty good. You know, it went down from 8 because it was really hurting when I came in this morning. It flared up on me. So when the weather changes, it causes a flare up. From hot to cold, it flares up. If I touch it wrong, it can flare up. So just don't know when the nerve's going to act up.
Well, there's a lot of people I think that can relate to that because that's called denervation supersensitivity. And basically what that means is your nerves usually come with a sheath, a covering, but you have no covering when you have a chronic situation like this or something, an injury that causes a chronic. So the point is that barometric pressure change can be felt. Somebody got knee, chronic elbow, chronic foot. Ooh, I know it's going to rain tomorrow. You're out there, you know who I'm talking about. All right, so if you would like some 8 to 3 relief, if your 8 pain would like to come down to a 3 in just a few minutes, You don't want to turn up your spinal cord stimulator the rest of the day, the rest of the week. Okay, then come in and see us, because we do help chronic type situations. Yes, even if they're that bad that you could tell when the weather's going to change, that nobody else can help you, that nothing else can help, and you don't want to have surgery again.
No.
Right? So then do something that you know can help, because we really don't pop people, we don't crack people, we adjust people, and people get better. And we see miracles every day. It truly is it's a neat place to work around. The only thing that's not neat is the paperwork. We're not going there. The point is, though, we love helping people here, don't we, Tanya?
Yes, we do.
And we hear from 10 o'clock.
To 1.
You're here earlier than that.
Yeah, I am.
It's from till 1. And then what time?
3 to 7.
About time to Parham.
It's 3 to 7, but really it's until the last patient leaves. So
What time we got here? Okay, the night before, Monday night.
9:30.
9:30. 9:30 on Monday night. So what does that mean? We don't work by the clock. We work by you, by y'all out there. So please give us a call. If you know somebody, love somebody, care about somebody, tell somebody. There is hope. You don't have to go through life in pain, just suffering it out or taking pain pills or muscle relaxers and trying to cover it up. I mean, you can fix it. You can get some serious help. We'd love to be the people to help you. But as long as you go to a good, caring chiropractor, and there are several. I'm going to go ahead and mention the names. There's another doctor that's going to do this with his own show. It's my show, right?
Right.
Or it's our show.
Right.
How about Dr. Aspinwall? Is he caring and competent?
He is.
Yes, he is. Great guy. Jim and Keith,
Yes.
both. So we as long as they're caring and competent, go to a chiropractor. Go to a chiropractor. All right. This is Dr. Gregor. We're going to wrap it up now. We're going to tell y'all to keep telling all your family and friends about the show. Maybe you don't want to come in yet. You're still a little scared. Well, then tell your family and friends. Everybody's calling in. They want to come in now. Time that they see the show. So just keep calling. We don't mind. The phones ring all day, all night. That's fine. Tanya answers them all, don't you?
I do.
God bless you. But we got a little help coming.
Yes.
Well, a little. Rebecca, but
Yes.
she's not at the front.
No.
Yeah, but we're going to get somebody at the front. All right, so here we go. We appreciate you all. We got more to show you because we didn't get to the light room.
No.
We didn't get to the hyperbaric room.
No.
We didn't get to the red light lasers.
No.
We didn't get to the personal auto trainer back there.
Not yet.
All right, so we got a lot more to show you. So you guys make sure you stay tuned. We're going to bring it back maybe hopefully inside, get you a peek behind the curtains. It's always interesting behind the curtains, isn't it?
It is.
All
It
right.
is.
Thanks y'all for viewing. This is Dr. Gregor with Miss Tonda saying remember to live your life out loud and fat adapted.